Hello, everyone.
Hi, Jamie. This is Al Weber. How are you?
Good. How are you today?
I'm doing all right. Thank you.
Welcome, welcome.
I'm glad to be here. Thanks for letting me give you an update.
Yeah, you bet. Looking forward to it.
Do you want me to test my slides just to make sure I can share?
Yes, please. That would be
I
fantastic.
just want to make sure too. It says the host isn't allowing it sharing at this point. I don't know if that means that I need to do something differently or
No, that would be on our end, and I'm gonna have to see if Tammy is able to do that or if I need to try to figure it out.
if she's the host, she may be able to do that. I can also quickly email this to her in a PDF if needed.
Yeah, might have you do that, and you could copy me on it too if you'd like.
Yeah, let me do that real quick. I think what I'm going to have to do is print this and then do that. And that way I can do it. Yes. Give me 1 minute.
Yeah, and it looks like Allison might be joining, or that the Rotary Club of Ames one is either
I'm
Allison or
on. Yep, I'm on. Hold
Hey,
on.
she's on. Hey.
Gosh, I have that it's five till or 4 minutes till. I thought it.
No, you're good. You're good.
Okay.
Alan was just asking about sharing his screen. Um, Welcome to your March 2nd, 2026 Rotary Club of Ames meeting. Let's begin with the Pledge of Allegiance. So if you're able, stand and rise and we'll lead the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for
Republic for
which it
which it
stands,
stands,
one
one
nation,
nation,
under God, indivisible,
indivisible,
with
with
liberty
liberty
and
and justice
justice for
for
all.
all.
Let's take a moment and keep some folks that might need our prayers, our thoughts and prayers. Let's just take a silent moment here. Okay, thank you, everyone. So we've got next week we'll be at the Plex again. So if anybody went out there today, apologize. We've been trying to keep everybody posted, so hopefully nobody was out there the first Monday of the month. So, but next week we'll be out in person again, and then talking about clean energy for climate. Um, then the 16th, the next meeting will be actually during spring break. So we're doing the off-site meetings where you go to one of these fine folks is opening their doors to kind of share more about their business. Please sign up if you haven't already. We still have spots available. In most cases, it's bring your own lunch, but you might be contacted if that's differently. It looks like a couple are lunch provided, so check that out and enjoy the fellowship and checking out the other properties there that part of our community. And then we'll be back online again the following Monday and then in person March 30th. So that's kind of a look at March, what we have coming up. Um, Community grants. We have submissions coming in for the 2026 community grants to review. There's $20,000 that we've got in our budget. 8 projects, each about 2,500 is roughly what they generally do. So support your local organizations. We love to fulfill these unmet needs. The applications can be sent over to our homepage. You can download the forms and read the online grant criteria. We'd like to have those by the March 27th, if we could have those submitted to the Rotary Club of Ames at gmail.com. So please spread the word. If you know of anyone that might be interested in applying for a grant. Look forward to hearing more about those. Um, and speaking of which, we have Al Weber here to talk a little bit about Ames Voice. I'll turn it over to you, Al.
Thank you so much, Jamie. I greatly appreciate all of you giving me the opportunity to give you an update. We've made quite a lot of progress since we last chatted, and we're very, very grateful to all of you for your grant. In many ways, your grant gave us some validation on what we were doing. We had made some progress, I think, when we last chatted, and there's been a lot more since. But it was because of financial support like yours and Paul. Lastly, I see Paul on here. Paul is also a supporter of ours, and we're grateful to all of you. We were able to leverage all of these gifts, and I'm happy to give you I think, a very positive update. I'm hopeful that all of you are subscribers, and if you're not, I would encourage you to become one. And I have a request later on what the club can do. So far, we've done, I think, a very good job since we last chatted. We have recruited a very strong board, and I'm happy to give you their names here in a minute. We've raised $100,000 and put it in the bank. That was part of our insistence when we started. We were going to only wait until we had our first year's budget in the bank before we launched, and I'm very happy to tell you that we were able to accomplish that much in great part to a program that we started called Founding Voices. And what you see here are a list of some names of people that committed a very nice donation on the front end and have also committed, in most cases, to an advertising commitment. Our most recent one is a member of yours, Mike Ewing from Grandin's has joined, and he is going to be sort of our target guinea pig to help us do what I think is going to be a real good addition to The Voice, and that is obituaries. And I'll tell you a little bit more about that here in a minute. We currently have two staff members that are both being paid, and I'm happy to tell you that. They're not making a lot of money yet. Both of them were volunteers, but we're hopeful that we can continue to upgrade their pay as we build more. And all of this has been done on the backs of some incredible local volunteers. I would argue that two of the people that help keep us going are two of our copy editors, Mike Crapful and Jody O'Donnell, have been instrumental in keeping us going. That picture is intentful because we kind of feel that we are a toddler and we're still toddling along and we've got a lot of work to do, but we're very optimistic on where we're going. In August, we reached our initial goal, and we decided then that we were going to do a soft launch. So we tested a lot of our technology in August and September, and then we officially launched on October 2nd. We had 40 members at the time. Most of those were people that were involved with this in the very beginning. And currently, as of this morning, I just looked, we're approaching 1,000 members, which I think is a pretty significant growth rate. We're hopeful that we can get to 2,000 by this summer and just keep growing. This is what it looks like if you haven't subscribed. Basically, what you'd get are two ingredients. We recently went to twice weekly. We now have a newsletter that goes out on Tuesday, and that's entertainment based. And we have a newsletter that goes out on Thursday, and that's more news based. And then there's a website. So, for example, if you saw this is the newsletter. You would get that story by my friend Bill Monroe. Bill's an interesting volunteer too. He at one time was the director of the Iowa Newspaper Association. He's retired. He lives at Green Hills. He's a very energetic 78-year-old, and he goes to every city council meeting and reports on it. And then you can see Pat Brown's ad there. We've got ads from Pat Brown and from Iowa Student Loan and from First National, and soon Grandin's will be on there. So if you click on that story, it'll take you to the website. These are the two folks that we've hired and are paying. The best news about this model is that 75% of all the money that we raise goes directly into staff growth. And our hope is to continue building staff, paying volunteers, paying editors, and ultimately growing our staff. Here are the board members. Dan Culhane was the first person that I recruited. Dan has been a great ally of this project and has been bullish on it. He was the first person. Allison Doyle was the second. And then Kevin Stowe joined also. All three of these people, I feel like if I'm TJ Otzelberger, we recruited three five-star recruits to this. Charlie Weaver is also a founding director. He works in Minnesota at the Minnesota Daily. He's been a very strong advocate of this and has been incredible at putting this all together. And then, of course, I'm in the mix of it as well. We're about to bring in two more board members. We've got them kind of recruited, and we're hoping that we can get them to join us in March. Obviously, we want to make sure we reinforce the fact that this is extraordinarily important to the community of Ames. There are people that say that we are a watchdog, and I still believe that that's what good journalism is. But to me, it's really all about the community. Community suffers, I believe, if you don't have a strong local news presence. So our goal is to steward community, engage the community, and essentially this is community owned. So we're going to be very, very focused on community going forward. Our mission, honestly, is to be the primary source of news and information in Ames. I don't believe that we are there yet, but we're getting closer every day as we put more coverage in and we make more plans. What makes us different, I think, is that we are only focused on Ames and Story County. It's locally owned, locally operated, locally focused. There is local advertising. I think the obituaries will help us a lot. All of the profits, if not most of them, are going to be invested back into the business. And our goal, our hope, is that this is nonpartisan. We have a balanced approach to it, and we're doing reach outs in all ways, but it's not always easy to do that. But that is what our goal is going to be moving forward. What does this really mean? I believe that if we do our job, Ames is stronger for it. We'll be able to tell a lot of stories that are currently not being told. Our focus will be on nonprofits, on local businesses. We've got a plan on high school sports coverage. We want to expand our school board coverage. Basically, what our goal is to document history in real time. That's what newspapers and radio stations that are locally owned and locally operated have done for years. What comes next? We're working very hard on collaboration. We've had great talks with the folks at the Greenlee School of Journalism. We're in conversation right now with the Iowa State Daily to do content sharing. Like I said, we went twice weekly. We're going to add some board members. We're also looking at hiring an executive director, and our hope, honestly, is to get somebody hired in the second quarter of this year. That will lift us off in a great, great way. But we're also going to be doing some community engagement. One thing you can do is mark your calendars. We're going to be sponsoring a forum or a discussion at the public library on March 23rd. Art Cullen, an author and a publisher in Iowa, will be here to present his new book, and that'll be a fun night. So March 23rd at the public library. What can you all do to help? We're still looking for volunteers. We want people who are passionate. We've got a bunch of them, but we can always use more. We're looking for board members. We're looking for editors, journalists, people who want to provide content. One new content provider that we're working with is Todd Burris. Many of you may know Todd. Todd was an outdoor writer for the Tribune, and Todd may be providing us with some outdoor content coming up. We always need help with fundraising and certainly grant writing. If anybody's an expert in grant writing, we'd be happy to talk to you. How you can connect, I know those are kind of funky, but if you want, I'll leave that slide up for just a bit. You can actually use those UPC codes. But if it's easier, this is the really good way to do it. Just go into midiowacommunitynews.org, or you can simply go to amesvoice.com. We are nonprofit. We are tax deductible. The tax ID number is there. We will give you all the documentation you need if you choose to donate. I'd be happy to answer questions if there are any. I wanted to get through that quickly out of respect to everybody, but if there are questions, I'm more than happy to answer them.
Al, there was one question in our chat so far. Does the members mean subscribers?
It's a great question, Jamie, and I'll clarify that. Basically, yes and no. There is no fee. This is a free, open forum, so you do not have to pay for it. The newsletters are all going to be delivered to you on Tuesday, and Thursday in your email box. And we're trying to be as respectful as we can. We did have some breaking news this past weekend that we were happy to report. So you might get breaking news stories every once in a while. We've had, I believe, 3 of those. But the membership piece is more modeled after the public radio and public TV piece. We will promote to people, hopefully urging them to donate, because that's how this is going to work. Essentially, the revenue model for this is based on donations, preferably from large donors, grants, advertising, and what we're calling sustaining members. So we're going to encourage people to donate, but it is not required. All of this is very free.
That's great. And you mentioned aimsvoice.com. Is that where folks could also, if they wanted to advertise their business, could go as well to
You
start the
bet.
process?
Yep, there's a link on there, and I'm not exactly sure I can direct them exactly, but they can certainly go in and say, let me know more about what advertising looks like. I'll share another quick slide. There's my email address. And right now, I'm acting as the interim executive director. I'm also the ad sales guy. I'm also the administrative assistant. So if anybody wanted to write me about anything, if they have a story idea, they want to just tell me a little bit more about what they believe, they can call me too. I may not answer right away if I don't recognize your number, but I'm always very happy to talk about this. Quite honestly, I'm proud of where we are. We've got a lot of work to do, but I truly believe we're on the right path, and I'm hopeful that we're going to be around for a good long while.
Fantastic. Any other questions for Al? Wearing a lot of hats for Ames Voice. Thank you, Al, for your detailed presentation here. Happy to hear it's going well, and good luck with the goal to reach 2,000 by this summer. That's awesome.
Thank you, Jamie. I'm grateful to all of you for your support. We couldn't have gotten this done without you, so thank you very much. I'll stop sharing and then I'll stop. Have a good
Okay,
one, everybody.
sounds good. Thank you, Al. Next, I think we'll have Patty Yoder tell us a little bit more about Food at First. Give you the mic, Patty, if you want to go from here.
Okay, thank you. Yes, we at Food at First have been extremely busy. The need is greater than ever. Our numbers have just climbed dramatically in the last year. And so we just continue every day. Excuse me, I have a little bit of a cold, so I sound a little bit funny. But we work 365 days a year to take care of those that need help. And so we're going out and picking up food all over town and bringing it back and sorting and organizing and cooking meals and giving out groceries. So it's a hopping place. And we're currently averaging 101 meals per day. And that is where the Rotary grant came in, that we were looking to update our convection oven. The one we are currently using is still working, but it's had quite a few repairs that have been needed because of its age. But Food at First is also a nonprofit, of course, and we run entirely on donations of food, money, and time, we say. So the food donations come from all over town, and businesses and food drives and leftovers from luncheons and anything at all we'll accept. And then, of course, financial donations are always needed. And then the volunteers are, the time is what makes this program run. We wouldn't be a program without volunteers. So anybody needs a volunteer hours, please go to foodatfirst.com and check us out. Yeah, I just want to thank Rotary so much. They've supported us for so many years, and the continued support just really means a lot to us here. And we just keep on working every day, and your support is what keeps us going also. So thank you to everyone.
Fabulous, Patty. And the work that you folks do 365 days a year is fabulous. It's sad that it's needed so much in this community, but hats off to you and your team and all the volunteers that do help out. From as Rotary spokesman, I'll say this: it's money well spent to help you out and continue to grow. Do you have are you ready to make any announcements on the future of Food at First, or is that to be determined down the road?
Not quite, not quite.
Okay. All right. Well, good luck to you. Thank you so much for sharing and all
Yeah,
that you do to help those in need in our community. So appreciate that.
thank you.
Mhm. Before I get to our keynote, I'd like to just also make a mention to remember there is the bake sale that is if we could bring some baked goods next week for the Rotaract bake sale, and they will take it from there. Basically, there's some requirements of packaging them up and what the ingredients are, but it sounds like the Rotaract kids would do that on their own. So if you have anything that you can bring those next week. Happy to see as many of those as we can to help folks out. If you have any questions, just let us know. And
Jamie,
yeah,
I just want to add that the handout we had at the last in-person meeting and probably a slide before that talked about having to that Rotary members would have to individually pack their own, individually wrap their each piece, and Rotary invested about $20 in sleeves, like your cookie from Schonert's came. So you do not have to wrap anything. Just bring it in a container or in a Ziploc bag, and Rotaract will individually pack those for you. I did put in the chat the Google Doc. ISU does have an allergen. Anytime there's a bake sale, there's information that needs to be provided. So please take the time to fill that out. And Rotaract is using this bake sale to raise money to support the blood drive they're working on with other student orgs on campus and some of their other projects that they're working on.
awesome. Let's show them some support and help out bring that next week. We did have a question here. Can we bring a commercially baked item? I believe you can, can't you, Tammy? Yeah.
Yes, and Carol, I would bring it because they're going to have all those ingredients on that label, most likely. So I think that's all that they would need is to make sure that the ingredients were on the label. So don't repackage your commercially baked items.
Yeah, that's a great question. And hopefully this will help their blood drive go well as well. So let's see if there's any other questions on that. No, I think that was it. I did see in the chat, Kate had put in a reminder in the chat about the offsite. So if you have any questions or want to email her to get signed up, please take a look at the chat there. And with that, I think I'll turn it over to Tammy to introduce our guest speaker today.
Great. Thanks, Jamie. We're really pleased to have Betty Stursma with us today talking about Iowa's new behavioral health services systems that has changed just recently in the past year, I believe, but she'll talk to us a little bit about that as well. She's the district leader for District 5 at the Iowa Primary Care Association. Prior to joining Iowa PCA, she worked in the CICS region. She has over 20 years of experience in behavioral health and disability services with a background in case management, service coordination, program administration, and finance. So, Betsy, welcome to Rotary.
There we go. Sorry. When I shared my screen, I had to find where my mute button was. Thank you so much for having me. I really appreciate the opportunity to be able to come. Hopefully you can see my screen okay. I guess I'll confirm that first. Can you see my presentation?
Yes, we can see it.
Okay,
Yep.
just want to make sure. All right, well, thanks for having me. I appreciate the opportunity to be able to visit with you today about behavioral health services in Iowa and kind of the transition that occurred in July. As Tammy said, I am Betsy Stursma. I am the district leader for District 5. We have kind of a team that covers District 5 from Iowa PCA. We have two senior lead system navigators, Bryant and Becca, and then we have currently 5 system navigators. I'll kind of talk about what their roles are in a little bit, but we are still hiring for at least one additional position, potentially more. Some of you may have heard presentations about Iowa PCA and the behavioral health system. It could have been from some of the other behavioral health system leaders as well. We have Abby Frenzy, who's the Senior Director of Behavioral Health Services, Emma Hall, who's the Director of System Navigation, and then Liza Maxwell, who's the Director of District Operations and Strategy. What I'm going to cover today, just going to kind of introduce the changes that occurred July 1st, what it used to look like, what it looks like now, how Iowa PCA's role plays in that, the new behavioral health system, what are the benefits for Iowans, providers, and partners, and then talk about our system navigation program, why it was needed, kind of what it looks like and how it can help and how to connect to that program. All right, so behavioral health services prior to July 1st were made up of, and we had mental health and disability services regions. There were about 11 in the state on June 30th. Story County, Ames would have been in the CICS region, so I'm pretty familiar with Story County and Ames since I worked for CICS prior to Iowa Primary Care Association. But things changed July 1st, and there was a system realignment. It went from mental health and disability services being provided, coordinated through the mental health and disability services regions, to splitting up that mental health and disability services. So now mental health and substance use services are together, and the new behavioral health service system. And then the disability services went with the aging services. So now they are with the aging and disability services. So kind of split those, realigned it. Really the primary reason for that overhaul was to streamline access and ensure consistent care across the state. Also, really trying to make it easier for all Iowans to access services and get the help no matter where they live. I'll kind of go into that a little bit more. A key component of the new system really is the Behavioral Health Administrative Service Organization, which Iowa Primary Care Association performs that function. So you may not have ever heard of Iowa Primary Care Association before, but we are a nonprofit association that's been around since 1988. So if you've worked with community health centers or in that area, you may be familiar with Iowa Primary Care Association. Because the 14 community health centers are the members of our association. Iowa Primary Healthcare has been long committed to expanding healthcare, really trying to get that integrated care to meet people's needs locally. Okay, so we talked about that there were mental health regions prior to July 1st, and now we have districts. So you'll still hear sometimes that people can interchange districts and regions, but technically we are now 7 behavioral health districts, and Iowa Primary Care Association serves as a central administrative and coordinating body for those 7 districts. Something that's a little bit different before is the regions had borders that looked much different than this map. The regions, if you lived a mile down the road and you happen to be in a different county in a different region, your access to services might look different. What was available may look different. So that's one thing with now having the districts and having a statewide organization that's kind of coordinating it, is that those district lines are much more blurry. They really don't determine any access to service based off of the district lines. So I always put that out there because I know sometimes Story and Marshall can share a lot of resources, and so there's really not a distinct difference between the two. So again, talking about kind of why the system alignment, what are the changes, what's the difference? Like I said, there could be different systems and could be confusing if a neighbor lived a mile down the road, their services, how you access services might be different. So outcomes weren't satisfactory. We hadn't really gotten to the point where we were providing outcomes to the state. And there was a large amount of duplicative administrative red tape. So providers definitely felt this in the fact that sometimes they were providing services in multiple regions. Therefore, they might have multiple contracts. They would have different people that they would be billing, etc. So, trying to provide and take away some of that duplication. So, with the alignment, the goal is to create consistent pathways for accessing services. So, again, the individual mile down the road, they're still able to access the same services that the others are. Looking at building and expanding services across continuums, one of the things that regions were really focused on, and it was based off of the state legislation, was crisis services. Iowa PCA has really been tasked with focusing on 5 behavioral health continuum areas, meaning we're really looking at prevention, early intervention, treatment, recovery, and crisis. So really kind of expanding maybe what the regions were doing and taking that broader look and looking at all of those behavioral health continuums. Also, really trying to focus funding towards more effectively towards outcomes. And again, trying to streamline administrative work for the providers. So I keep this slide in there because usually providers want to know about it, but also I think it's important for individuals to understand Iowa Primary Care Association. We contract with over 128 organizations, and that's statewide, and it's primarily for access and sustainability of services. Prior to July 1st, regions provided access and sustainability funds, but also provided individual payments for individuals that were either uninsured or underinsured for direct services. And that has changed a little bit. Iowa Primary Care Association, we're really just charged with that access and sustainability funds. But you can see the different areas that we are providing funding for. So looking at the integrated provider network, they largely provide substance use services, tobacco community partnerships, community mental health centers. We now provide funding or a pass through from the state to us and then to community health centers for the mental health block grant. Again, we do a lot of access and sustainability for crisis services. And there's some others there as well. So like I said, the big difference is we don't necessarily, if Betsy needs to go see a therapist and I don't have insurance, prior to July 1st, regions paid for that. Now that's not the case. It is actually billed directly to HHS. So if I need to go to a therapist and I don't have insurance, I can go to a Medicaid provider in good standing, and they are able, so basically most Medicaid providers, and they are able to then make sure I meet eligibility criteria, and then they can bill that for that therapy session directly to HHS. And that is through the Safety Net Management Information System, or SNMIS. So that is true not only for the behavioral health services, like fee-for-service type stuff, but it's also for like disability and long-term services and supports as well. So that's more of like our supported employment, all of those types of things. I should say too, I probably kind of missed it, which is, I really talked about the regions did mental health and disability services, and the mental health went with substance use to Iowa Primary Care Association. I do just want to share that disability services went with aging, and some of the regions became a disability access point. And so that is how you can access like long-term services and supports through the SNMIS is the disability access points. All right. So one of the services that Iowa Primary Care Association is providing directly is system navigation. And so really what we saw statewide as a whole was that individuals and families had a really hard time knowing how to access the behavioral health system. It seemed complex, confusing, and just people didn't know where to go. And that complexity, and especially if you're in crisis or your family member is in crisis or you're just stressed, it's really hard to figure out where to go for help. A lot of times people just kind of freeze. And so what we really wanted to do was create system navigation. So it is a personalized one-on-one support to connect with individuals to help them navigate the behavioral health system. We're going to go kind of through like some examples here in a little bit, but really that's what it is. Help, be somebody who can come alongside individuals, families, loved ones, community members to come alongside and kind of help people navigate through the system and find the appropriate resource. So what do system navigators do? They provide extensive information, education, and guidance. They offer application assistance for services. So that is something that some regions, CICS was one of them, previously did, which is helping people apply for maybe Medicaid, Social Security disability. Even it could be housing applications. It's something that's just confusing for an individual that is preventing them from getting the services that they need. So offer assistance helping individuals do that. Also can identify options to overcome barriers to accessing behavioral health services. One of the things I'm currently in the middle of writing our district assessment and identifying kind of our gaps and challenges and barriers. And one of the big ones is transportation, as I'm sure everybody hears all the time. But that is another thing, just like kind of helping people work through, like, is it a transportation barrier? How can we help you get to your appointment? Those types of things. And also providing support during key transitions. This is kind of if individuals are coming out of jail, prison, if they're coming out of inpatient hospitalization, really kind of helping provide that support during those key transitions, because we really feel like that's important to get that individual connected to those community-based supports to be successful. Again, and then we're providing referrals and warm handoffs to the appropriate providers and long-term services. So again, this is things that we don't provide treatment, we don't provide medication or counseling or crisis intervention. We're really to help people navigate the system and come alongside them to get the services and supports they need. So how do individuals access system navigation? For patients, supporters, and caregivers, we ask individuals to go through Your Life Iowa. So they can call, text, or chat, really let Your Life Iowa know that you're looking for system navigation and need somebody to come alongside. They can reach out. We're trying to make Your Life Iowa kind of that very bright front door so that people know, like, okay, if I go there, I can get the help I can get to the help I need, right? It's not going to maybe be that first stop, but you're going to get connected with somebody who can take you through those stops to get you connected. We do have entry points for providers and partners. So particularly law enforcement, jails, managed care organizations, the disability access points I kind of talked about, they have that ability to reach our system navigation directly and not have to go through Your Life Iowa. The other piece, so typically our system navigation is done over the phone. So again, go through Your Life Iowa, get connected to our system navigation program. But we are adding on-site locations. So currently in District 5, we have somebody in Des Moines. We also have somebody twice a week. We have somebody in Decatur County. We are working to get a location solidified in Ames. So I hope that's close. I haven't followed up with the rest of my team, but I know that that's something they were working on. So very excited about that. You can always see our location and hours, like what days our navigators are where on our website. So that QR code takes you directly to our website and that web page. I will say, again, the nice thing about it is if we have a location in Des Moines and somebody wants to go see a navigator in Des Moines or in Marshalltown or anywhere, they can go to any of our system navigator locations as well. So that's not like you don't have to just stay within those confines of the district locations. But no appointments are necessary and walk-ins are welcome. Again, we talked about providing those assistance with those applications. It's really hard to help somebody work through completing an application over the phone. So these in-person access points will be really good. So what makes system navigation unique? Again, we have system experts. I've talked a little bit about the statewide view that Iowa PCA has. That is one benefit we have. We have local navigators, obviously, to District 5. I kind of showed you on that earlier slide. But the nice thing is they have a network of navigators across the state of Iowa that all have different areas of expertise and experiences. So I know I've seen kind of some of their chats that they have where they have this unique situation and somebody, it's a situation here in District 5 and somebody up in Northeast Iowa has a maybe statewide resource that's available or kind of the steps they know to help walk alongside that person to get the help that they need. It is brief and focused intervention. It's not long-term case management. So if somebody already has a long-term case management, really our function is to get them back connected with that care manager that they may have. Oftentimes, if there's turnover at the MCOs, we will find that individuals don't know who their case manager is. And so we can really work with them to try to figure out who that is and get them reconnected to that. It's low barrier and no cost. So it's entirely free to anybody in Iowa. It's not to just utilizers of the safety net system. It is open for anybody to utilize. When I was first transitioning positions and telling a friend about my new job, I was telling her a little bit about system navigation, and she's like, "Oh my gosh." She's like, "I was just deciding that I needed to get my daughter into therapy. I just had no idea where to start. Like, it's so overwhelming to just Google." And so she was saying, she's like, "Oh my gosh, I wish I would have known that that was available, and that would have been a really good option." So again, no insurance, no income requirements. It's really open to anybody to utilize. It has a broad reach. The other thing too, oftentimes people think of like only the individual's families can call, but also I think it's a really good resource for other helpers in the community. We have a lot of great community resources out there. Other people who are doing similar work, and we don't want to take over what they're doing, but we want to also be able to help the helpers. So that's why we have that community partners and providers number, so that if I'm working with this individual and I become stuck and unsure, like what else is out there, how do I help them? That helper can reach out to system navigation as well and help connect, and we can help that way as well. Also, we recognize this is one way that we're trying to reach some of the more rural areas and provide services to them. That way, it bridges that gap in care. And so there's accessibility to system navigation regardless of the geographic location. Okay, so here I kind of talked through some examples as we go, but I'll kind of go through these quickly, probably maybe skip around a little bit. But so just how can we help individuals and families? There's a rural resident newly diagnosed with depression, doesn't know what behavioral health services are available in their area. Sometimes it's even, I don't know what my insurance accepts, or where can I go with my insurance. So the navigator can identify local or telehealth options, connect them with care. And the other big piece that I haven't really talked about much, but there's a closed loop. So let's say an individual calls, they're looking for that therapist. We suggest they go here. We might even do a three-way call, get them connected and hooked up with that service, get an appointment scheduled, make sure they have transportation, they have all of that figured out. But then after the appointment, we can also follow up, and we do follow up and make sure, how did it go? Did the transportation work out okay? Did you make your appointment? Was it a good fit? I really think that oftentimes people feel like, okay, well, once I get into a therapist, like that therapist is going to be the best match for me, and don't recognize necessarily that just because I started with this therapist, maybe it's not a good fit and I need to look at something else that would be different. So that's kind of that closed loop is important. Again, especially the other thing we're seeing a lot is parents just kind of unsure where to start when they're identifying maybe some concerning behaviors from their kids. So again, we can kind of help assess what their needs are, educate them, and guide them through referrals to get the services that they need, whether that's mental health or substance use. Again, individuals leaving hospitalizations, those transitions of times of care could be really overwhelming. So again, we can kind of help arrange transportation, help them figure out what transportation options there are and get to those appointments. So again, talking about professionals and complex needs, here's some other examples of what we can do. Oftentimes, law enforcement is called for an individual maybe that's not receiving any treatment or care. Sometimes it takes time, but we can work to engage the person, build trust, and then coordinate care for them. Sometimes that can be a really important piece. The other thing we can do is to connect them to co-response or outreach teams that might be available. Let's see. Here's another one that I think is important, which is like a trusted adult sees someone in distress but doesn't know what to recommend or how to help. So again, sometimes people call and they say, "Hey, I'm concerned about my neighbor. They need some help. Sometimes it's like, okay, can you give us their information and are you good with us calling them and reaching out? We're absolutely able to do that. But sometimes people aren't always comfortable with that. They're like, no, I just kind of want to have some information so that if it comes up, I might be able to present it with them. We can absolutely do that third party referrals and call the person directly, or we can provide the referee information and just give them information and kind of arm them with some tools that maybe to be able to help the neighbor. Another one, the last situation I'll just kind of point out is a person with co-occurring mental health and intellectual or developmental disabilities falling through the cracks with each system thinking the other should take the lead. What our navigators are going to do is really bridge those systems. I talked about that earlier with like their case managers, reconnecting there. But also what I want to say is sometimes people are getting confused now between the behavioral health ASO and behavioral health system navigation and the disability access points. They also have navigation. And I really believe it's a no wrong door. So just start somewhere. That's kind of what I tell people. Start somewhere. And if it's not, we're not the best entity or organization to help. We'll bridge you and get you to where you need to go. All right. So I do have some resources, primarily the one that would most be beneficial for you guys, just our website, which has resources on it. Also the ability to sign up for our newsletter if you want to continue to get more information and updates. All right, that was a lot of talking. So what questions do you have? Let me see if I can get to the chat. All right.
Yeah, we've got a few in the
Yeah,
chat, Betsy.
perfect.
If you can you get to it?
Yes.
Perfect.
Yes. Okay. Yes. So, let's see, Warren. Oh,
If you could read the question
let's see.
and then
I'm not
answer
sure
it.
if that one's for me or not. Alan,
Um,
I think that must
oh
be
yeah,
somebody
no,
else. Yep,
that
that's
one.
his. Okay,
Yep.
here we go. Is there a list of all the contracted entities, organizations, and the services they are providing available publicly? Um, at this point in time, I don't know that that is anywhere publicly. I'm guessing, and Ashley, you can kind of let me know if you're looking for something specific. We do, as system navigation, try to keep um, kind of a running resource guide, I guess, for all the system navigators to do. That's something we utilize internally, just because, as you probably know, it's so difficult to keep those up and up to date constantly. That's what we find with some of the online stuff. So we utilize that internally, and then are able to do because again we have that statewide, vantage point that as people are calling and doing those three-way calls, if something's changed or something's different, they're able to update that in that resource guide. As far as who we contract with, it may be on our website. I don't know, but I can get back to you on that. All right. Michael had a question. What percent in numbers of psychiatrists and psychologists see Medicaid and Medicare in Iowa and compared to other states? I don't necessarily have the statistics on that. I know one of the things Iowa has done is trying to create more access, but workforce remains an issue. Again, I talked about that I'm working on our district assessment, really looking at what are our strengths, what are our gaps and challenges. I think one of the still issues we have is that we just a workforce, and that's at all levels, all continuum of care. So, not sure how we compare to other states. I know historically we've been lower, but not sure. Let's see, our budget and funding from Iowa legislature. So basically our funding it's kind of a mix of funding. It all comes from HHS to us. Some of it is state dollars and some of it is federal pass-through dollars. And I do not know what our statewide budget is. I know we are waiting for the legislature this year to give us what are kind of the HHS appropriations. Depending on what is appropriate to HHS, then will be determine what our agency budget is that we then pass through to the providers.
So, Betsy, thanks so much for your talk today. It was very informative. I'm the one who asked the questions though about the psychiatrist and the psychologist because I'm a retired physician, and Medicaid actually underpays physicians and psychiatrists compared to other states. In fact, for the evaluation and management codes, Medicare pays one third what Wellmark and the commercial insurance products are paying physicians. And the physicians' Medicaid payments are only 2% more than in 2001, 25 years ago. The payments are only 2% more than they are right now. And mental health is certainly neglected, but Medicaid payments in Iowa are set by the legislature, even though 72% of the funding comes from the federal government. So I would urge you to do some lobbying to help you get more psychiatrists and psychologists available, as well as primary care physicians. But again, thanks for your talk today. It was
Yeah.
informative.
Yeah, no, I will definitely echo what you're saying. So again, we're doing our district assessment and planning process for next year for fiscal year 27. And part of that is really looking at, listening to the providers. We sat down and did conversations with all of our contracted providers. And one of the things that I heard frequently was the sustainability based off of those Medicaid rates. I know that that's an issue. They really feel like it's impacting their workforce, right, which is impacting the availability of services. So, yep, definitely heard that. And I mean, I think that that's the other thing I will say is with Iowa PCA and HHS, we are more closely aligned. It is really a shared responsibility model. And we didn't have that with regions. Again, I came from the regional perspective, so we didn't have that tie-in like Iowa PCA and the Behavioral Health Administrative Service Organization does. So I'm hoping that we will continue to be a voice for those providers about those issues and the challenges that they can create on the system as a whole. So, yeah, no, thanks for that feedback. I appreciate it. Hi, Lisa.
Hey, Betsy, how you doing?
Good.
Good. So just for everyone's knowledge, I worked with Betsy when she was with CICS, and now with District 5. I am the current advisory chair for District 5 ASO, of which Betsy is with, and the Disability Access Point, or the Aging and Disability Access Point. I am the advisory chair for that as well. But my question, Betsy, is part of your presentation talked about the outreach and particularly into the rural area. So how are you really trying to get education out there besides like just saying, hey, there's a QR code? How do people find out that they should go to you or to the Disability Access Point, whichever, but how do they find that out so that they aren't kind of spinning their wheels at home until they find you?
Yeah, I mean, I think that is also a part of our district assessment and planning process. I think as you'll see at our district advisory council later this week, and then as our plan gets finalized, I think that that's a really important piece. I think still awareness is a huge part of the access issue we have in Iowa, especially in those rural areas. Again, I'm hoping part of my plan will be putting, just really working with HHS about how can we get some additional marketing. I know the state does, like marketing blasts a lot. Your Life Iowa is one of those. But how can we get people to understand that Your Life Iowa isn't just going to be a crisis call? Because I think sometimes that's not what people are looking for. They're looking for somebody to come alongside of them to figure it out together instead of just being that simple one call, like, here's your local therapist. Well, I know, but I used them last year and we didn't really have a good relationship. Being more than that. And so that's really what I'm hoping we can do, part of it. And the other part we're looking at is creating some more local coalitions and groups. Because one of the things that I really found in our assessment process is that, right, most communities there's a hub of information somewhere, right? You kind of talked about it with the online platform that you guys provided some funding to earlier in Ames. Like usually there's some connections there, like where people go to for information. And so I think probably a more effective, is going to be having local coalitions, having local collaborations, and giving them the information and then being able to distribute it out to those who they work with. So. That's my plan to put in my plan. So we'll see how it goes.
Thanks, Betsy.
Yeah. Hi, Ashley.
Hey there. Betsy, can you talk a little bit about maybe the differences or the similarities between Your Life Iowa, which you did a great job of presenting on, and then what some of us may have heard is the Thrive Iowa initiative with the state?
Yeah. I don't know that I can. I can get you some additional information, but I haven't really had a chance to dive into the Thrive information yet. So I know that the state has a lot of initiatives going on right now, and I know that's one of them. Also know that's they have their HCBS home project going on. They have CCBHCs going on. There's just a lot of new programs and initiatives they have. So I really can't speak to that. Sorry.
Okay, thank you.
Yep.
Any more questions for Betsy? Betsy, great information. Thank you for sharing about your services, the conflicts that you have, and the work that you do is certainly needed throughout the state. Look forward to seeing more in Story County if that's possible down the road.
Yeah.
But yeah, thank you so much, Betsy, and everyone's questions that they had for you. And then you had put up the QR code. What was your website again if people want to see more information?
Yep. I can put it in the chat. How's that sound? I
Yeah,
will
perfect. That'd be
oops,
great.
put some of that information here in the chat.
Thank you so much.
Yeah.
Really appreciate that and your time today. Great presentation. I also want to thank our grant recipients, Al Weber reporting on the amesvoice.com. I see there was another chat Al had put in there about the support Warren Madden's given him as well. I just wanted to acknowledge that. And then Patty Yoder for all of her information on the grant recipient for Food on First. So thank you, everyone. Thanks again, Betsy. And with that, we'll go ahead and close out. Have a great week, everyone. Please stand and help me with our four-way test of the things we think, say, and do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? Thank you, everyone. Have a great week. We'll see you next week in person.